You just passed the NCLEX. You got the job. You're officially a registered nurse. And right now, you're absolutely terrified. Your hands are sweating. Your mind is racing. You're wondering if you actually know anything at all. And here's what I need you to hear before we go any further. That feeling doesn't mean you're not ready. It means you care. I remember my first day on the floor. I couldn't even find the supply closet. I accidentally called a physician by the wrong name. I spent 20 minutes trying to figure out the medication dispensing machine while a patient's call light was going off. I went home that night and cried in my car. But here's the thing, I made it. And so will you. Today, I'm giving you the advice I wish someone had given me. The real stuff, not the textbook answers. The survival guide nobody teaches you in nursing school. Let's get into it. First, imposter syndrome is real, and it's normal. You know that voice in your head. Everyone's going to find out I don't know what I'm doing. I don't deserve to be here. What if I hurt someone? Nearly every new graduate nurse experiences this. Feeling like you don't know enough is not the same as actually not knowing enough. You passed nursing school. You passed the NCLEX. You learned pharmacology, pathophysiology, and critical thinking. The difference now is that it's real. There's no simulation ending, no instructor stepping in. That gap between I learned this and I'm doing this feels enormous. But that gap closes, day by day, shift by shift. Give yourself 6 months, then a year. You will look back and be amazed at how far you've come. So remember this, competence builds confidence, and competence takes time. Second, ask every single question. This advice might save a life, including your own career. I don't care if you think it's stupid. I don't care if you asked yesterday. If you don't know, ask. I once knew a new grad who almost gave the wrong dose of insulin because she was too embarrassed to ask someone to double-check her math. Embarrassment is never worth a patient's safety. Pride is never worth your license. The truly dangerous nurses are not the ones asking questions. They're the ones who stop asking. The smartest, most experienced nurses still verify. They still say, "Can you double-check this with me?" That's not weakness. That's professionalism. Third, find your people. Nursing is not a solo sport. You cannot do this alone. Find the coworker who answers your 3 a.m. text about a weird lab value. Find the charge nurse who has your back when things get chaotic. Find the mentor who remembers what it felt like to be new. During my first month, an experienced nurse took me under her wing. Anytime I looked panicked, she'd say, "We're going to figure this out together." Those words carried me through more shifts than I can count. Find your person, and one day, be that person for someone else. If you're in a toxic environment where nurses tear each other down, know this. That is not something you have to endure forever. You deserve a team that supports you. Fourth, time management will make or break you. In school, you had 1 or 2 patients. Now you may have 4, 5, 6, or more. That you cannot give every patient 100% of your time at the same moment. You have to prioritize. At the start of every shift, ask yourself, who is my sickest patient? What absolutely has to happen on time? What can wait and what cannot? Cluster your care. When you walk into a room, don't just do one task. Assess, medicate, check lines, address needs, combine what you can. Will you feel behind at first? Yes. Will you get faster and more efficient? Absolutely. Time management is a skill. You build it intentionally. Practice it like your career depends on it, because it does. Fifth, you will make mistakes. At some point, especially in your first year, you will mess something up. Maybe it's small. Maybe it's charting. Maybe it's forgetting to pass along information. Or maybe it's bigger. Making a mistake does not make you a bad nurse. Hiding it does. Refusing to learn from it does. When you make a mistake, be honest immediately. Report it. Protect the patient. Reflect on what happened and how to prevent it next time. You will feel shame. That's human. But do not let one moment define your entire career. Some of the best nurses I know became exceptional because of a mistake they never forgot. They turned it into growth. You can too. Sixth, protect your mental health. Burnout is real. Compassion fatigue is real. Moral injury is real. As a new grad, you will want to give everything. You'll stay late. You'll replay shifts in your head. You'll carry patient stories home with you. But that is not sustainable. Leave work at work as much as you can. Have a life outside of nursing. Talk about what you experience. Take your days off seriously. Rest is not laziness. Rest is recovery. You cannot pour from an empty cup. Your well-being matters just as much as your patients. Finally, never stop learning. Nursing school gave you the foundation. Your real education starts now. Read. Take continuing education seriously. Ask experienced nurses about their reasoning. If something confuses you, look it up after your shift. You don't have to know everything today. You just have to commit to knowing more tomorrow than you know right now. So here's my final word to you. New graduate nurse. You will doubt yourself. You will feel overwhelmed. Some days you will question your choice. But you will also change lives. You will hold hands during the hardest moments. You will notice the subtle change that prevents a crisis. You will be the calm voice in someone else's storm. That is powerful. That is meaningful. That is nursing. Be patient with yourself. Ask for help. Find your people. Protect your heart. Keep learning and keep showing up. The world needs nurses like you. Now go be the nurse you were meant to be. You've got this.